Pasadena, Jasmine Veal, KCAL 9 News.
The FDA meets tomorrow to decide whether to authorize the Pfizer vaccine. It's been distributed now for 2 days in the UK, and health officials there warn anyone with a history of serious allergies should not get the vaccine. At least two people have had reactions on the first day it was given. KCAL 9's Chris Holmstrom has a closer look at that warning.
It's day 2 of Pfizer vaccinations in the United Kingdom. They are the first nation in the Western world to launch a mass vaccination program against COVID-19. While experts call it a historic day, there were 2 people who had a significant allergic reaction to the vaccine. Dr. Michael Hurt is the founder of the Center for Integrated Medicine in Tarzana.
I think this is something that we should expect, news to come out every day of people reacting differently to what is basically a brand new biotech public health weapon that's never been injected into humans before.
The National Health Service in England said in a statement both of the medical workers who experienced anaphylactoid reactions to the Pfizer vaccine had a strong past history of allergic reactions and that both had recovered after the treatment. Now they are advising people with severe allergies to get the vaccine. It's important to note they are not talking about seasonal allergies.
People who have severe allergies are those who walk around with an EpiPen, who need to inject themselves with epinephrine if they got a bee sting or ate a peanut or had some kind of reaction where the throat's going to swell, the eyes are going to swell shut, have trouble breathing or swallowing.
British health officials warn that includes people who've had a significant allergic reaction to a vaccine or medicine in the past. While the United States will likely start giving the Pfizer vaccine next week, healthcare workers and people living in long-term nursing facilities will be the first to get the dose. But Dr. Hurt says people with the 3 O's should consider getting the vaccine when it's available. That includes those that are older, overweight, or have other medical problems like asthma, heart disease, and diabetes.
People who have high risk of dying or being seriously ill with COVID need to look at this vaccine very seriously because the risk of taking it may be much less than the risk of facing down COVID one-on-one.
And the state is expected to get doses of the Pfizer vaccine next week, and about 84,000 of them will come here to LA County. Reporting in Studio City, I'm Chris Holmstrom, KCAL 9 News.
And the Pentagon says it will initially get